substance in there to kill the worm. You just need to visit your dental clinic, and then there are so many procedures that we perform to treat the caca that we have. It's not a procedure to remove any germ, it's just a procedure to relieve the pain and also to save the tooth. So that's about the caca. When I finish, you have the opportunity to ask your questions so that if there's any other thing surrounding this whole caca myth that you want to ask about, I'll gladly answer for you. Okay, so we're moving down to something we call halitosis. Has anyone heard halitosis before? The young ones have heard halitosis before. Okay, so halitosis is a big word. That basically means bad breath. I'm sure we've all sat in a trotro with someone who is releasing certain gases for us that we can't even breathe. Now, this halitosis, people think it is coming from the head. I don't know where they got the assumption, maybe because of one of its origins. Now, halitosis has so many causes, and there are two major types. Now, there's halitosis, which is the true one, the one that really you have. Then there's a false one, or psychological one, that you and we think we have, because we are so conscious about our oral health. Now, this halitosis, the false one or the psychological one, when you are there and you feel like there is something smelling or there is something coming from your mouth, you just have to find a confidant, someone who you trust. Ask the person, sister, brother, do I really have anything coming from my mouth? So this person will tell you genuinely, yes, you do, or no, you don't. But if you are there and you are assuming that you have, this halitosis can just bring down your self-esteem. So we advise that if you think you have halitosis, you get someone whom you trust to verify for you. Then we come to the true one. With the true one, there are a couple of causes. There is the oral cause, which is very obvious for us. When you come to the dental clinic, it's very easy for us to find. And the plaques that I explained initially are part of the oral causes of halitosis. Then there are cavities, people who have a lot of cavities between the teeth or on the teeth. And these cavities or caca produce a lot of bad gases, which make our mouth smell. Another cause is systemic conditions. People who have diabetes, people who have certain blood issues, leukemia, anemia, very severe anemia, have halitosis. Some people have kidney issues, they also have halitosis. So certain medical conditions that people have might predispose them to having poor oral hygiene or ultimately mouth odor. Now we are coming down to the one that is very familiar to us, the oral ones. When we come to the plaques, these plaques, the food particles merged with germs that I initially mentioned. I mean, bacteria smells. Wherever bacteria packs itself, it produces odor because its activities releases certain gases that makes our mouth smell. So if you have those green, yellow, brown stuff between the teeth, definitely you are going to have some form of odor. So that's why we also advise that you visit your dental clinic wherever you find yourself in the world for professional cleaning. Then the cavities also, if there are cavities between your teeth, your dentist deals with it for you and you are free from odor. Another part of our mouth that we take for granted, especially for the kids, is the tongue. The tongue is a very, very important part of this whole deliberation. You see, when we brush our teeth, we forget the tongue or we ignore the tongue. And then we visit our tongue when we are almost done with the brushing. We are brushing, then we remember, say, oh, my tongue is there, and then we leave. And so when you ignore your tongue, your breath will also ignore you. So it's very important that you focus more on your tongue when you brush your teeth, especially the posterior part of the tongue. Okay, especially the posterior part of the part of the tongue where you feel like vomiting when the brush goes there. You see, when you're brushing your tongue and the brush gets there, you feel like, ow. So that's the part that you really, really have to focus, especially for the kids. For the kids, usually you have to force them to even brush their teeth. Can't talk less of their tongue. So you have to just find your way around it. Use single strokes. So you can be brushing the teeth, then by the time they realize your brush is there, and you're like, you just grab it once from the middle, then you go to the side, then go to the other side. And then when they finish, even for all of us, after brushing your tongue or brushing your teeth, you try and gargle down your throat. You take the water down there, you do, sorry, you just let it bubble down your throat to remove all the food particles that are hiding in crevices at the back of your throat. So it removes all these things that can cause bad breath. Even during the day, when you feel like your breath is not smelling so nice for you, you can just get water, you just bubble it down your throat, and it clears all the remnants of food particles that may be causing odor for you. So the tongue, like I said, carries about 80% of breath issues when it comes to the breath factors that is caused by the oral cavity. And so that is that about the oral causes of halitosis. If anyone tells you something is coming from someone's head, so after the dentist sees you and tells you, oh, your mouth is cleared, you know, you believe in yourself that you brush your teeth well, you brush your tongue well, you'll be referred to see an ENT specialist because your problem might not be coming from your mouth and you might be disturbing your mouth thinking that you have something coming from your mouth. So the ENT specialist will just check your throat area and then your nose area. There's something called sinus. There are these big spaces that are hiding behind our cheeks. So this whole part of our mouth, upward our mouth, beneath our nose, it's filled with big, big spaces which contain fluid. And these spaces, when you get infections there, you can have mouth odor because there's a huge connection between the nose and the mouth. And so bad gases or foul gases travel from our nose down into our mouth. When we talk, we smell it as bad breath. So these are the few pointers about breath that I want to share with you. If there are any questions you would like to ask or any topic you'd want us to discuss. I was told we were going to do a dental screening, so I prepared a short message. That's why I have to cut it here so that we ask our questions. Any topic relating to dental issues, anything you've heard from a dentist or from someone somewhere that you'd want us to deliberate more on, I'm more than willing to explain to you. Auntie here. About it. Okay, so about the braces. Braces indeed are only, and the emphasis is on only, for correction of dental abnormalities, as in poor arrangement of teeth. people who have overlapping teeth, something we call symbol glass, someone with teeth like that, people who have a lot of spaces between the teeth, even the diastema or edge that we like so much, there are abnormalities that we correct with braces. We use braces to close them. And also people who have teeth that are forward and backwards. I say, yeah, multiple teeth. You've seen it. Those things are all corrected with braces. Now, lately, because of social media and the love for money, business people, regular people like you and I, go online, go to Alibaba, go to AliExpress, wherever, and we purchase all these items called fashion braces. The key word there is fashion braces. Because when they see you and your kids wearing braces, it's nice to them. And braces are sort of expensive. So if someone is wearing braces, it's assumed that you have money or you are well-to-do. So, And when braces are worn, it has these colorful bands that we place around them. It looks very fashionable. The colorful bands around braces, it looks very fashionable to people. So, because of these colorful bands, people like it, and so they go in for the fashion braces, which is trending on Instagram and everywhere, and they just place them on their teeth, and it's very cheap compared to real braces. Whereas real braces would be spiking around 20,000 there about, they are selling those for about 500 cedis on Instagram, and yeah, very cheap. And I don't know, they can remove it and fix it again, so we don't promote it. We don't advise you put them on, because when you put them on without professional direction, these things trap food particles and they leave the plaques on your teeth, causing dental issues that you may not know of. So we don't advise the use of those fashion braces, because there are ways we go about the proper braces. There are ways we clean. The advice we give to people wearing it might not be the same advice you be given when you buy it. You might just buy it off Instagram. They'll just deliver it to you, show you how to fix it, and that's it. And then when you have dental issues, you might pay a lot of cedis to go fix your dental issues. So for braces, they are purely for correctional purposes. If you see them on the rise these days, it's just because parents are becoming more enlightened. Dental facilities are springing up all over. The education is going up there. Parents are now becoming so educated that they want their kids to have things that they didn't have. So whereas your teeth might be looking like Shakazuru's teeth, yes, you want your kids to have a good set of teeth. So a lot of kids are wearing braces. They go to school, their friends see it, and they go forcing their parents to send them to the dental clinic. We check and we realize they need braces, so we fix them for them. So that's basically about braces. Now for the concoctions they sell on the market and in the church stations and stuff like that. We've tried. The Dental Association is trying its best to try to educate people on these things, but people are still stuck in Congo years where they think that when they have a dental issue, they need something harsh to clear it instead of going to see a dentist. And then dental treatments are a little bit on the high side. So instead of going to a dentist to get it treated, they'll prefer to go and buy a concoction. They'll talk to their family members, their relatives, to tell them what to do. So when they get these concoctions and they have problems, they resort to us. So we're really trying to educate people against the concoctions. We don't even advise the use of stuff like TCP, even hydrogen peroxide. We use it in our facilities, but in moderation. We have procedures also that we use hydrogen peroxide for. But people buy it because they feel it's harsh, and because it's something they've seen a dentist use before, they want to use it in the house. So that's for those concoctions. The only thing you can buy that is safe for you to use at home, that's liquid, it's a mouthwash. Yes, even with mouthwashes, some of them are very harsh. So we have specific ones that we usually advise people to use. And the regular ones that we don't even advise for people to use in the dental clinics. I don't want to spoil someone's business, so I won't mention the name of the regular one. If you come to me, I can tell you. Okay, so that's a part, yeah. Whitening. Okay, first and foremost, kids are not supposed to do teeth whitening. So kids below or children below 16 years, you don't advise teeth whitening. So teeth whitening is a cosmetic procedure, purely cosmetic. God gave you sets of teeth. There are different shades of teeth. There's shade between A1 to about D7 or so. There are so many shades. Some have very white teeth. Some have teeth in between. Some have very yellow teeth. And then another thing about the color of teeth is that as you age, your teeth will not remain as white as they were when you were a kid, because there are so many factors that come to play. The food you eat, for one, comes to play in the color of your teeth. In our setting, we eat a lot of foods that contain color. In the European setting, they take a lot of coffee and a lot of tea stuff. So even they have more browner teeth than us. So the food that you eat plays a major role. Now, this cosmetic procedure called teeth whitening, it is very safe. Previously, we were not getting proper ones that could whiten the teeth. But now there are whitening gels that can whiten the teeth to a favorable level that you want. But even with that, the procedure is not too pleasant. So for me, if you come to me wanting to do teeth white, I'll tell you the pros and cons, and then I'll hit on the cons because the cons might put you off, and I'll be happy because the color that you want to achieve, the whitening procedure will not get you there. If you see pictures on Instagram and other places, those pictures have been touched, and so you will not get realistic pictures on Instagram. So when we do whitening, we advise the patients that your teeth are not going to be as white as you want. It's going to be a bit better, but it's not going to be sparkly white. If you want your teeth to remain sparkly white like that, you have to probably whiten once a year or once every 6 months, because the solution we use for whitening is very strong. It is hydrogen peroxide, the same hydrogen peroxide you know, but in a very strong concentration. The one that you use is about 6%. The one we use for whitening is about 35%. Yes, and that is very, very harsh. But it's not deadly. It's very, very safe. So in the clinical setting, there's a way we place them. So it wouldn't cause problems for you. So whitening is safe in the clinical setting. There's even a whitening gel that we can give to you to take home to do a home whitening procedure, which is also very safe for you. But you have to know that your teeth are not going to be as white as you want. You probably have to repeat it a couple of times. Maybe after the first session, you might be happy with the outcome, so you want to repeat it a couple of times, but you shouldn't repeat it so frequently, else it will weaken the protective layer of the tooth, which is the enamel. Doing it once or twice is safe, but if you become addicted to it, that every week or every morning or every month, so far as you have the gel at home or someone has led you to the whitening clinic or something, you want to repeat it every now and then, that one makes it very, very unhealthy for your teeth and it's unsafe. So that's about whitening for you. And then whitening, the reason why I discourage people is that when you do whitening, your teeth is not going to remain as white as they were when you did the whitening. Even though it's not going to become so white, it will become a bit whiter than what you came with. And that whitened state, it's not going to remain as white at that stage forever. Because when you finish whitening, you are going to eat. You are going to eat your red, you are going to eat your palm nut soup. So it will go back to where it was. That's why people become addicted and they want to keep whitening every now and then, which is quite dangerous for the active. So that's about whitening. Mm, I missed that point. Okay. Thanks for bringing me back there. Okay, so the breath that you have in the morning, that is very normal. The breath that you have when you finish eating kenke, very normal. The breath you have after taking garlic or onions or even sometimes rice and chicken with stew, have some breath. That's also very normal because these things have certain gases that can make your, when mixed with your saliva and the bacteria in your mouth, can give off foul smell, which is normal, but it's not as bad as someone who has proper halitosis. So when you, and even with the waking up one, there are various degrees. There are some people that when they wake up, they don't smell anything. Those are one of many people who are just scattered all over the world. You'll be waking up with your husband, and your husband is like, I don't know, and then they also you know, but that person, because of physiological changes, might have a different breath, which might not be as foul as yours, and that is normal. The bad one is after brushing your teeth. When you finish brushing your teeth, and then you are walking, you meet someone, you're talking, and the person is like, yeah, that one is proper halitosis. There are some people that they don't need to talk to you. They just breathe on you when you are running away. And those ones especially are signs of those who have issues with their sinuses. And with the sinuses, you have to see an ENT specialist. But you might not know. So your first point of call with halitosis or about bad odor is the dental clinic or the dentist. Oh, you could tell if you are very close to the person, you could say, oh, I've seen a dental clinic here. I want to go and see what they do there. Can you escort me? Or oh, I, one of my nurses does that all the time. When she sits in a public transport, she's always telling them she met a man in a public transport, and the man was trying to woo her. And then something was not adding up in the nasal area. So the person trying to woo someone was killing her. And so she, wanting the man to shut up, told him, oh, uncle, have you seen a dentist before? And then the man was like, oh, no, I've not seen a dentist before. And I was like, oh, I think you need to see a dentist. That was the end. The man stopped talking. So for her, that was her strategy. So, yes. Yeah, but you have to find a way around it. So for me, when people come with such issues, I tell them, oh, take a gift voucher and give to the person, oh, I got this gift voucher. I want you to go and see a dentist just for checkup. If you think the person knows, then the person really knows. Oh, really? Ah, then that's the person's problem. Yeah, to save you. Yeah, approaching here. Oh, okay. It's a very difficult topic to bring up. Personally, I've sat in church next to people and I couldn't breathe. So, and I couldn't say a thing. Sometimes I'm led to talk to the person to give the person a free dental treatment to solve the issue. But because I'm shy, I'm not like shy, but it's difficult telling someone that, oh, you have this issue. But I mean, a couple of people I just asked to come for dental checkup or free cleaning. Genuinely, I know this is their issue. So when they come and I'm educating them on general issues, I really hit on that point. Say, this thing, you have to do it this way, that way, this way, that way. And it's a general education, so the person will not really notice that I'm really trying to tell the person that, oh, this is your issue. Yeah. And some of them, you see that this person is adamant, so you tell them point blank, your breath is not nice. And the person takes it cool. Everybody is very conscious about the breath. So someone hearing that from you is actually lucky or becomes very happy that you've actually told him or her about his breath. So I think we should just master courage and try to confront some of these, if they are relatives. If they are relatives, I mean, relatives fight all the time, so you can just fight there and then, and next time you are making up and you are laughing and everybody will become cool. So if it's a relative, I think it's a safe space for you to hit the person. In 2 months, you'll be back together, laughing and eating chichinga somewhere. So I think, yeah, that's it. Pardon? Yeah, it's treatable. If it's dental, the things I mentioned, there are procedures we do to eliminate them. If it is from the nasal region, which we claim is from the head, you see an ENT specialist after referral from us. But if you are very sure it's from your nose, you go straight to the ENT. They will deal it. They have procedures. They can rinse the nose, the sinuses. They pass tubes there to rinse the sinuses. If it is from your general system, we also refer you. People with ulcers also have bad breath, so yeah, they treat it. It's easily treatable. Yeah, auntie.
Adverts. See adverts on.
Yeah.
And we are using
That's a very, very important question. That's something that is on the rise now in our society. Now, previously, we had our grandparents used to give us charcoal and brodity to clean our teeth, and we claim they made our teeth white. Personally, because of science, I don't think there's really a connection. I think it's because charcoal is black and our teeth are white. Immediately you brush your teeth and the charcoal is on it, you're like, ee, my teeth have become white. And so it really takes a very long time for any of those products you mentioned, the baking soda, the whitening toothpaste, even charcoal, to make your teeth white. You have to use it consistently for a very long time. Charcoal has a cleaning effect. Charcoal can brighten the teeth a little, but it is not that instant. You won't experience that effect after using it for 1 week or 2 weeks or 1 month. You will have to use it consistently for about a year. Even with that, there are people who naturally their teeth are stubborn. With the grade acroatia, it won't change color. Now, even with our whitening procedure that we do at the clinics, if we don't achieve the effects that we want with some people, because their teeth are just stubborn. No matter how you whiten, it won't change color. So you might be wasting your money on this expensive toothpaste, whereas you could buy a regular toothpaste, which will be safe for you. When it comes to toothpaste, the most important component of the toothpaste is fluoride. People are advocating against fluoride. Someone like Ohineba is on Man FM talking against fluoride in toothpaste and all that. Now, fluoride in huge quantities is bad for our body, but the quantity that we put in toothpaste is very small, very, very negligible, and it is science-based, so it is very safe for us. You need fluoride in the toothpaste to make your teeth strong so that it fights against cavities. So when these acids from the food reach your teeth, they wouldn't break down your teeth. If you are consistently using toothpaste without fluoride, you are making your teeth susceptible to cavities in your teeth. So we advise the use of fluoride toothpaste. For toothpaste, just make sure the toothpaste you are using contain fluoride. If it's a charcoal toothpaste you want to use because you want your teeth to become white in your mind, yeah, you can use that, but make sure it has fluoride in it. But just know that using that toothpaste alone will not make your teeth white. You might have to use it for ages before you notice a little effect. And so that's that about that. For the herbal toothpaste are good for the gums. So you can use it. It's, just make sure it also has fluoride in there. So I recommend Colgate Herbal, Pepsodent Herbal, a couple of herbal toothpaste coming up, because herbal things are good. So you can get a herbal toothpaste if that's what you want. But the charcoal, even charcoal is quite abrasive. It will make your teeth white, and it sort of eats away the enamel. So consistent use is even a bit bad. So we actually fighting against the marketers of the charcoal toothpaste. That's the charcoal in there that they are advocating for people to use. No, it's not making the teeth white, and it's abrasive. It's wearing off the tooth enamel also. So that's about the toothpaste. Any question, please? So, yeah.
Because I know some people, they don't want to brush that in them, or they just pour it, bubble it through their mouth, they're good to go. So I just want to know.
Hydrogen in place of brushing? No. No, a big no. It is called toothpaste for a purpose, and you can't replace that with even mouthwash. Mouthwash has a different function. Toothpaste has a different function. They have different composition, even though they are similar. I think the one that merges the two is the soapy base and the mint in there. And some people add some additives just to make their mouthwashes funky or make it a bit interesting. So you can't use even a mouthwash in place of toothpaste, let alone hydrogen. Hydrogen, like I initially said, is not to be used by you in your mouth at home. You are supposed to use it to dress your wounds, and it ends there. Please don't use it in your mouth. It is too harsh. It disturbs the natural microbes in the mouth. There are some natural microbes in the mouth that help the food in your mouth to break down. When we eat food, digestion begins from the mouth. There are natural microbes in the mouth that are supposed to be there. You use harsh chemicals to wear these natural microbes away, so the digestion is not really effective. You give your stomach too much work to do if that happens. And it can also cause a lot of problems in your mouth. It can create ulcers. It can merge with other conditions and give you cancer if you are using something harsh in your mouth. If you have cancer in your mouth, it's not because you are using hydrogen, but it can cause that because it will be wearing off some part of your teeth which is supposed to be protecting you. Some part of your gums that's supposed to be protected will be bleached away by the hydrogen and leave you like unprotected. And so you can develop a lot of conditions here. So that's about that.
Doc, I want you to educate us on the use of toothpick. I hear toothpick is not good, so advise us on what to use. Can we use the trapia to the local one?
What is trapia?
The cheese stick.
Oh, okay. Okay, so toothpicks are not good for us to pick food from our teeth. There is something called dental floss. I'm sure it's very common these days, so I'm sure you've come across them. Those thread-like stuff. Now, because of exposure and education, all of us probably have met it. That's the best thing for removal of food particles from the teeth. Now, with a toothpick, you see it is shaped like a triangle. It has a pointed, it's like a cone, sort of. It has a pointed tip. Auntie has it. Don't worry, they get it, so I've seen. The floss. Yeah, please bring it to me. Auntie, Auntie, yes, please. Okay, so with a toothpick, it has a pointed tip and a wider base. When you put the pointed tip between your teeth, Auntie, okay, so when you put the pointed tip between your teeth, as you keep doing that to bring out the food particle, the wider base keeps pushing the teeth away from each other. And so, that every time you realize that you are always picking the same place, because every time you do that, the space enlarges until every time there is more food particles packing there in one particular location. That is why we don't advise the use of toothpick. It makes the natural space between the teeth wider. There are these natural spaces that God created. It's not space that we close. Oh yeah, then even if you close it, that thing you put there will remove. So we don't block the natural spaces between the teeth. So the toothpick we are using is pushing the teeth away from each other, creating a bigger space. That's why we don't use a toothpick. You can use your toothpick for your chichinga and stuff, but don't use it to remove food particles from it. We didn't know ages ago that's what we were using because that's what we got. But because of education and modernization, the floss has come. Maybe in some years to come, a new something will be developed and we would prefer it to the floss. With the floss too, personally from my 11-year experience, I don't advise the use of this type of floss. You can have this in your bag when you go to a restaurant or you go to a public place and you want to pick food from your teeth. But this one doesn't really do justice to your teeth, so you'll be tempted to use the pick parts to bring out food from your teeth. Even though this one is not as rounded as a toothpick, the pointed bit can prick your gum and cause mouth ulcers. So I don't advise the use of this type of toothpick. So there's another type, which is the modernized version. Auntie asked the question. Yeah, that's also a type of this. Yeah. So there's a modernized version, there's the original version of this. The original version is a thread. It's a thread. That's the original one that came. People don't like using that one because it's quite cumbersome using it because you have to open their mouth and pass it between their teeth. Yeah, but that is the best for bringing out food from the teeth. Now with that, what I advise my patient is that you can tie a knot in the middle of the thread somewhere. See, when you put it between your teeth, you just pull it from one end to the other. The knot will bring out every food that is stuck there. Even with the toothpick, when you keep doing that, you are rather pushing the food further inward, and you will not bring out all the food. You might see a huge chunk coming out, but there's a piece there that is causing problems in the gums. So with the floss, the type that I recommend, you just pull it from one end to the other. It will bring out every food that is stuck in corners that your floss or even this one cannot reach. With this one, if there's food stuck there, you can do it multiple times, but it might not come out. So you can have it for fun or if you are going to a public place. But get one of those ones. It's a small pack. It's called dental floss. This one is also called dental floss. Just tell them that you want the one that you can pull from the pack. It's a lot in the pack. You can use it for 6 months, it wouldn't be finished. So you can just have it in your bag, use it at home or use it wherever you go, and you are good to go. So that's about the floss for us. Technique. hmm I mean, I don't have one here, but usually I teach my patients how to use it. There's no trick really. The technique is just to stabilize it so that you can use two fingers, just two fingers. Like if the thread is between your teeth like that, you just take it there and then you. If I had it, I could have shown it to you, but I couldn't carry my whole clinic here, so please pardon me. Yeah. That's, if that's all the question. We can proceed. Yeah. Mm-hmm.
Some of them, can you seal it up, or you have to extract it?
Okay, so with the cavities, there is a normal cavity without pain. People have multiple cavities without pain. But these cavities, if not filled, or what you call sealed, it's not, it's left open. If you don't seal it, germs can go deeper into the tooth and start causing pain. And so when it gets to the painful stage, there are various treatments that we can perform on the tooth to save the tooth. Taking it out is the last resort. I mean, if you can't afford the expensive treatment to save the tooth, or you are not just in the mood to save the tooth, you can just have it taken out. But it doesn't mean that every time you have a toothache, it will be pulled out. So because of that, you shy away from going to the dental clinic. Uh-huh. Okay. Uh-huh. uh, okay, so okay, so with that, you probably have a different auntie. I'm solving your problem. So with that, you have a different problem. Your issue is not a cavity. What you think is a cavity is not a cavity. It's just a normal space between the two that has widened because of probably the presence of your last tooth. There's something called wisdom tooth. The wisdom tooth, a few people have it. A lot of human beings don't have the wisdom tooth. Now with the wisdom tooth, those few people who have it, it causes problems for them, like in your case. So because of its presence, baby on the last part, it accumulates food between that tooth and the last but one. So it allows, as food gets stuck there, the gum shrinks away from the teeth, so natural space becomes a little bigger. So more food tends to pack there. You start feeling some pain or discomfort. Sometimes you have swellings there. For people, some people just feel food getting stuck there. Some feel pain. Some feel they have swellings there. And so with the wisdom tooth, the only option is to take it out. If that's what they told you, then I'm sorry, that's your only option. If if it's really the wisdom tooth, then the best option in all cases is to take it out. Else it will keep disturbing you. It will disturb you forever. So for the few people who have it, you can't tell if you have the wisdom. If you are blessed enough to see your mouth properly and you can tell that you have a wisdom tooth, then fine. But for those who have the wisdom tooth, they are teeth that we take out all the time. If a dentist is playing with your wisdom tooth, then the person is just wasting your time. Eventually, it will have to come out. That's about the wisdom tooth. Yes, please. Yeah. Yeah. So there are people who are natural grinders. These natural grinders, you can't stop the jaw from grinding. Some people grind because of stress, and even some children have stress. They grind a lot. The grinding is a sort of a psychophysiological condition. It's not something you can control. If you are being told you grind, you can't stop it. You can't make a conscious effort. And you might not even know that you are a grinder. So usually we advise people who sleep, if you have a spouse or a relative who sleeps with you, you let the person observe you when you are in deep sleep. It's at that point that you might grind. And the person cannot observe you throughout your sleep. So the person, maybe the time that you start grinding, the person might be asleep. But some people grind so loud that even when you are sleeping, you hear grr, 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 grr. And especially children, because of maybe maltreatment by a teacher at school, a bully at school, or even we parents, sometimes when we get too frustrated, we can let it out on children, and all these things can cause some children to grind. And so if someone grinds, we have appliances or devices that they wear to prevent the teeth from grinding against each other. In severe cases, these appliances can also prevent your jaw from even grinding. One can prevent your teeth, can make you grind all right, but your teeth will not be grinding against each other. With the other one, your jaw will be locked. Even though you are wearing the appliance in your mouth, your jaw will be prevented from moving. That is in severe cases. So that's the only solution for grinders. And there's no medicine, there's no surgery. You won't even want to perform a surgery just for something as simple as grinding. The effects of grinding is the tooth wear. So if it happens, we deal with the effects. We have treatments for it. So that's about grinding. Okay, thank you so much for the questions. They were lovely.
Yeah. Thank you so much, Doctor. Yes, so I think we'll proceed to the screening. Yes, we'll go and start the screening. So I don't know how, are you going to teach us how to brush? So when, during the screening, you teach.
Okay, so
You can hear her. You can hear her.
Let's brush like this. In fact, me, sometimes I do. We all are brushing like this. Your brush there. As a brush. Oh, okay. So as you brush like this, the brush wears off the part of the tooth between the gum. That's the space between the tooth and the gum. And it wears off the tooth, exposing the tooth. So some people have severe sensitivities. When they drink chilled water, they have that electric shock-like sensation. That's because they've brushed like this for so long that the brush has worn off that part of the tooth, exposing a very, very sensitive part of the tooth. And so we don't advise brushing like this. Now, previously, we advised brushing this way. That's what we are all familiar with. Even a lot of people are struggling to brush this way, myself inclusive. This particular way of brushing is very, very difficult to achieve. So a new method has been devised. The new method is brushing in circular motions. So you put your teeth together. You put your teeth together. It's very, very simple. When you go home, try. It's very simple to brush in a circular motion. It's just like as you are brushing this way. You just move it around like this. The reason why we brush in this circular motion is to break from this constant motion. Because brush is saying there's friction produced. It's just like rubbing your hand against each other. The heat produced can wear off your skin. That's what happens when you are constantly brushing this way. Your brush wears off the teeth because of the friction produced. We want to break away from the friction. That's why we advise brushing in circular motion. It's so easy and convenient. You can put your teeth together and brush in circular motion. and go around like that. Or you can open your jaw, brush the upper part like that, brush the lower part like that. But the inner part, if you can brush in circular motion, fine. But it's easier to go this way. As you are brushing the inner part this way, you are not applying too much pressure. So it will not cause a similar effect as it would have caused. Because most of us, because we want good smiles, we want people to see that our teeth are clean, we exert so much pressure when we are brushing the frontal parts. But the inner parts, we feel lazy to brush there. So that part, I think you can brush that way. We advise that you brush in circular motion there, but it's very difficult. For me, I like realistic things. It's difficult to brush in circular motion when you are brushing up there. So you can go that way and you will be safe. Your teeth will not be harmed in any way. So that's about brushing. No more brushing up and down. Now it is circular motion brushing. Yes, please. So another mistake we make, as you brought up the brushing, another mistake we make is brushing with hard brushes because we want our teeth to be clean. We assume, say, the hard brushes clean the teeth better. We assume that the hard brushes clean the teeth better. But that is not true. The hard brushes have very hard bristles. Ayadin, how do you use this hard thing to brush something that is so curved and smooth? You see, the surface of the tooth is very smooth. You can even use cotton and toothpaste to clean your teeth because our teeth are very shiny and smooth. The reason why we use toothbrush is that the toothbrush is supposed to go in between our teeth to clean the spaces between our teeth. Our teeth are individual teeth. Individually. So these individual teeth standing next to each other have spaces between them. These spaces, that's where food particles usually get trapped. Now, when you use a hard brush, it's not able to go to these spaces between the teeth. And so instead of going between the teeth to clean, it rather scratches the part between the tooth and the gum. That part is a very delicate part. And as it is scratching there, it is wearing off that part, exposing a very, very sensitive part of your teeth. So people tend to have their sensitive teeth. So that's why we don't advise the use of hard brushes at all. In effect, as it is not brushing your teeth well, if you realize people who have green stuff between their teeth, when you ask them, they'll say, oh, maybe brush na no yet dim pounds, I didn't mean call. Maybe it's because the brush is not doing any work in the mouth. And in but he thinks he's brushing well because the tooth is curved. It's curved like that, like Auntie standing here. She is curved. If I have to go around here, I have to go like that. Using hard brush, which is just going straight. Yes, those are the areas that cause issues for us. A lot of dental issues arise from these food particles that get stuck between the teeth. Most of them you might not notice. Like I said, everybody has it. Even when we do professional cleaning at the clinic to remove these food particles, immediately you leave and start eating, they get stuck between the teeth. That's just how our bodies are. And so you can't force those particles to come out with your hard brush. In effect, you need a soft to medium bristled brush. Like this one. This one is from Colgate. Colgate brushes, I mean, they are international, so they are trusted brands. I'm not advertising for them, but I just like the brushes. They are very standard. You can even feel the difference. When you feel the bristles, you will see that this is quality bristles. The hard ones, the bristles they use are very hard, and it is cheap for them to acquire the hard one. Yeah, VIP smokers. This one, I don't want to mention because it's a local. Yes. This is, yes. It's hard. It's not able to clean properly between the teeth. And so a lot of people using these brushes, yes, smokers, VIP, they are having a lot of dental plaques packing between their teeth. So the type of brush that we use for adults is the medium to soft bristles. So when you are buying the brush, I mean, the standard for everybody is medium. It's very difficult to get soft on our market. If you find soft, fantastic. But for most of us, because we think the hard ones are the best and we are used to the hard one, moving from hard to soft is very difficult for us. We feel say, yes, so we try to stick to the medium, which is standard for everybody. How do you know the brush is medium? When you are buying the brush, the pack of the brush, rubber na brush nishemuno, you're sure whether it's hard, medium, or soft. It's always written on it. So when you're buying, just choose based on the hardness of the bristle that way. Auto brush ni and Troya, just don't buy it because it's not a good brand. And don't buy from those who sell in the wheelbarrows. Try to buy from a shop or a pharmacy, especially because there are a lot of fake on the market. And those in the wheelbarrows, they always sell the hard ones. And they'll try to convince you to get the hard ones. Sure, brush with quality, yeah. So just get the ones from good pharmacies. And like I said, Colgate is a trusted brand, so you can go for Colgate. I don't even the use of Pepsodent toothbrush because Pepsodent toothbrush is hard. They are now trying to make medium bristle brushes. It's a local company. I even have their products here to share with you, but I don't like their toothbrush. I've told them their brushes are too hard. So because they knew that we thought the hard ones were the best, they were producing hard ones for us. They've written Pepsodent hard, extra hard, those things, yes. But now because people are educated, they've realized that people are getting to know that the hard ones are not the best, so they are producing medium ones. So you can, if you find the medium, fine. But if you get the old Pepsodent brushes, please stay away from them. Me, I ignore Pepsodent altogether. So now we can proceed to the screening. So, are we doing it here? So in the screening, little auntie wants to ask a question. Okay, so electrical toothbrushes do all the work for us, but it's not too common on our market. If you find it and they've written medium, just follow the instructions on how to use it. Don't say because it's doing all the work for you, you just put it in your mouth and you still have to move around. Even though it is rotating, you still have to move your brush around to clean. Yeah, that's me. Me, at a point, I was advising against electrical toothbrushes, but now there are new ones which are really doing well. So if you get good ones, fine. You can use them. Yeah. My assistant wants to ask a question. Oh, experts.
Then if that person is not adamant, he or she will be conscious of themselves. And let's say the person is a little bit rude. When the person is rude and you want to talk to the person, oh, hello, sweetheart. And that day, another day, bibi unkwe mam. Yeah. Bibi unkwe mam. Edi Jenny ana. Anyo, edi ya. Oh, debut. Ane unkwe you. Edi bibi a me un dental clinic bisha kona hadi wa. Dan me call ho, we am fine pa. Nta o yen kwahwe. Be un de sero so a, un de wosini finfin. Unkwe ye. Adi yellow bi na o hwehwe wo no. Onye nkase o. Onye dompe. Oye nyama bi a o build kakran kakra. When you talk to the person in that calm manner, na sebi or your bedroom bar, on no one kun. Obe say no, bibi nkwe yenti na woka chiro. But one say sometimes is the tone of how we also talk to people. Our tone also pushes them away. But if you tell the person, oh, I saw this and that, it wasn't all that perfect. Why don't you follow me? If it's not your fault, then we are done. Oh, Pacho, that's it. My boss, oh, about to add your channel. No, I trash you.
Yes, you are making it too simple. But it's not as simple as that. True.
Because it's everybody knows it's difficult to tell somebody. So nipa master courage no etimi catcher. Even though the person we are initially, I mean, human beings, we respond, we are aggressive, we respond like that. The person might be angry initially, but later now it's not in his own cool or dream where you know that you are trying to help him or her. So I think if it's someone you meet on a regular, you can find some of these small ways to talk to the person. The person will be cool. Or fire, well, you can write to management or something, unless he owns the company.
Yeah, so we'll proceed to the children's service for the screening. I hear there'll be 2 people screening, isn't it?
Yeah, we have some. Pepsodent toothpaste is good because it contains fluoride. Is there a toothbrush that Ghanaian dentists we don't like? No. Okay, Pepsodent. Well, they gave me toothpaste to share, so I have to promote them too. But the toothpaste is good. It has the right amount of fluoride. That one is good. They have various types. The ones with herbs, the herbal toothpaste, Pepsodent. They have the regular. There are so many alternatives to choose from. But for me, I mean, toothpaste, you choose based on your preference. Some toothpaste claim to make the teeth white, even though they don't make the teeth white. If that will make you sleep at night, you can get it. Hey, uncle, come and help me. Okay, yeah, so that's about toothpaste. So we'll share a couple of
Pepsodent. So thank you very much. Thank you very much, Doc. So we'll just proceed. Yes. So how are we going? Yeah, how are we going? Should we? So line by line from the front. Okay, so Salome and or can we arrange the chairs in the middle so that there are chairs there, so we all go there?